Hello, I'm going to talk about cryptosporidiosis. This is the name of the disease. The pathogens that provoke this disease are Cryptosporidium carbon and Cryptosporidium bovis. The age of onset is 1 week to 3 weeks, and the risk factors are fish exposure, the contact with feces, the contaminated water, the humidity. The most important is not consume colostrum and change in diet. Cryptosporidium parvum is zoonotic, and Cryptosporidium bovis is not zoonotic. The clinical signs of this disease is the rotation, diarrhea, the white to yellowfish fish, sometimes present bloody diarrhea, and the preventive measures are involved strict hygienic protocols. It's very important. The adequate amounts of colostrum for neonates. The parturition in a clean environment. The isolated infected animals. The control rates, mice and flies. The preventive measure for human about this disease is boil and filter water, filter drinking water. Disinfect vegetables and fruits. And finally, avoid direct contact with human or animal feces.
The pathogen we are presenting is Salmonella. The name of the disease is Salmonellosis. It presents at the age of 7 to 21 days. The risk factors are colostrum and milk contaminated, the presence of animals like dog, birds, cats, rats, and providing contaminated food with an animal origin. This is a zoonotic disease, and the clinical signs are diarrhea, dehydration, white to yellow feces, arthritis, and preventive measures are providing good quality food and clean water, eliminate fauna, birds, mouse, vaccination during dry period, pasteurize colostrum, and the preventive measures for humans are making sure milk is pasteurized, washing and disinfecting the equipment and clothes, disinfecting the vegetables and fruit, and only drinking purified water.
Hello, I'm going to talk about the Brucella SPP pathogen. The disease of this pathogen is called brucellosis. The age that the animals can get it is 2 weeks to 1 year or more time, 30 and 60 days about. The risk factors for this disease are exposing livestock in place where the disease is endemic, the artificial insemination with sperm contaminated, the ingestion of microorganisms that are present in abortion fetuses, lick the genitals of infected animals. Failure to vaccinate livestock. This disease is zoonotic because it can be transmitted to humans. The clinical signs are co-abortion, infertility in both sexes, the infection of the accessory sex glands in males. The preventive measures for animals are strict hygiene protocols, isolation, calf and cattle vaccination. The preventive measures for human are that make sure that milk is pasteurized. Can be protected by wearing impermeable clothing, rubber boots, gloves, and face masks when handling infected animals. Avoid the ingestion of unpasteurized cheeses. That's all.
Hi, I'll talk about the pathogen Leptospira spp. The name of disease is leptospirosis. The age of onset is from 2 days to 4 weeks. The risk factor is exposure with urine contaminant, contact with soil contaminant water. It's a zoonotic disease. And the clinical signs is dyspnea, clear red or port wine colored urine, atypical mastitis, mortality, abortion with retention of the placenta, the fetus is autolyzed and icteric, anemia, anorexia. The preventive measures of animal are to have a selection of replacement stock for leptospirosis negative herds, vaccination, control of rats, separation of cattle from swine and wildlife. The preventive measure for humans are don't touch the animal urine, only drink purified water, and disinfect vegetable and fruits. And this is all.